An American woman shared her experience after a thumb injury in India cost just ₹50, praising the country's affordable healthcare. Kristen, an American living in India, had a small kitchen accident. She cut her thumb so badly while chopping vegetables that she thought she needed stitches. But what shocked her wasn't the injury, it was the medical bill. Hello viewers, I'm Kavya Khandelwal and you're watching The Edge. Today we'll break down her story, why it's getting millions of views and what it says about the big difference between healthcare in India and the United States. Kristen has been living in India for a few years. One ordinary day, while cooking at home, she sliced her thumb deep enough that blood wouldn't stop pouring. She tried applying pressure, tried wrapping it, and nothing worked. Finally, she looked at her partner Tim and said, "I think I need to go get some stitches." So, she got on a cycle, thumb wrapped in a bandage, and rode to the nearest hospital. Now pause here and imagine this. In the US, if you even walk to an ER, you are looking at a minimum bill of $2,000. That's around 1.6 lakh rupees, even before the doctor touches you. But what happened next in India left her stunned. The hospital staff took her to a small emergency room, quickly checked her bandage soaked in blood and tried different ways to stop the bleeding. One nurse wrapped it up in a way that worked perfectly. To her surprise, they said she might not even need stitches. Within 45 minutes, she was done, and then came the real shocker. At the reception, the hospital charged her just ₹50. That's less than the cost of a cup of chai at many cafes. The story sounds unbelievable, right? But here's the thing, it's not always this rosy. Kristen's story highlights India's affordability and accessibility, but it also opens up a debate. Why is healthcare in US so expensive that even a tiny cut could drain your savings? And why is Indian healthcare a mix of super affordable in some places and very costly in others? Kristen's video touched millions because she pointed out three simple things. Number one, proximity. The hospital was so close that she could literally cycle there in minutes. Number two, no waiting time. In the US, ER waiting times average anywhere between 2 to 6 hours for non-life-threatening issues. Kristen, she was seen immediately. Number three, the cost. ₹50 compared to $2,000, even accounting for currency differences, that's like comparing a mango to a gold brick. The video blew up on Instagram with more than 1,14,000 views, and the comments section turned into a global town hall. One user wrote, "India's healthcare is the best in the whole world." Another said, "There's so much medical help in India and it never feels like it comes with the strings attached." People also shared their personal stories. Some said their daughter spent ₹40,000 for a similar issue in the US, while in India, it would have been max ₹1,000, including medicines. And it's not just about the money. In many Indian cities, you will find charitable hospitals run by trusts and donations where charges are kept as low as possible that healthcare stays accessible to everyone. Of course, this doesn't mean India's healthcare is perfect. Private hospitals can be very expensive. Rural areas struggle with doctor shortages and sometimes quality of care can be uneven. But Kristen's experience shines a light on a side of India that often gets overlooked. Here's the twist. Kristen didn't just stop at sharing her bill. She ended her video saying, "Just another reason why I love Indian healthcare so much." Now think about that, an American praising Indian healthcare at a time when many Indians themselves often criticize the system. Sometimes it takes an outsider's perspective to remind us what's working well. So here's the story in a nutshell. An American woman cut her thumb while chopping veggies. She cycled to a nearby hospital in India, got treated in under an hour and was charged just ₹50. She contrasted it with the US where such a trip could easily cost $2,000. Her video went viral, sparking a bigger conversation about healthcare, affordability, accessibility, and the massive gap between countries. And maybe, just maybe, this story is a reminder that while India still has a long way to go in healthcare, it already has something priceless: accessibility at a price people can actually afford. What are your thoughts on this? Tell me in the comments, and don't forget to like, share, subscribe, and follow The Edge.